Hi, I'm Dr. Ben Oldfrey. I'm a lecturer with the Global Disability Innovation Hub at University College London, and I work primarily on mobility and looking at prosthetics, orthotics, wheelchairs, on where localised production systems could better facilitate provision of these items globally. That's one field of work, and then I have another stream of work that looks particularly at the skin interface, so where devices are touching the body, comfort is instantly a problem. We look at sort of more fundamental materials work, developing soft materials, intelligent, smart materials that could improve that question of comfort and a question of tracking interaction with devices in general.
Can you share why you think it is important for your research to have diverse inputs?
Absolutely. So diverse inputs is critical and is being recognised much more widely in the development of product and services. Previously, when both research and product development has been done, when things have not involved many different stakeholders at all, problems that could have been found out at that design stage, they suddenly arise later on, and suddenly a barrier that could have been solved isn't. And one of the reasons, the sorts of problems that arise of that nature, they're often more complex than, say, one individual interaction. So, for example, the design of a new prosthetic device for a user. We might address many of the problems that I've mentioned, comfort earlier, that could make a device comfortable. But if that device isn't really, it doesn't fit in the system in which it needs to be provided in, it isn't viable and it won't make it to market. So, but we need to be investigating and developing products with these diverse inputs and a range of different stakeholders. And the one way in which I like to think about it is we're more and more starting to engage the users of assistive technology in the design of them. That's critical, but I still feel like that's almost step one in this diversification of stakeholder input. Also important is to think about more of the steps of the way in which a device might be provided, and the system in which it's going to work. And there's many stakeholders within that system that will have a perspective on how to make that product viable. For example, allied health professionals, physiotherapists, occupational therapists, they're often not in co-design groups, and we're looking to change that as we see them as important figures as well as users themselves.
How have you used diverse participants or co-design in your research?
Yeah, so an example is where we're developing bespoke products in Nepal, and one that's to take a step back on how we actually got to that work stream at all is the fact that we wanted to work on developing some local innovation capacities in country. Now, we had lots of ideas on that, the GDI Hub and our programme AC 2030. We've worked in lots of different countries, we've got experience across various aspects of the provision system, but we'd never really worked in Nepal. So our first step there was, even though we had some ideas, we wanted to put together a community of practice in Nepal. We called them the Enabling Fridays community. So Fridays is a day where that people have a little bit more extra time in Nepal and could give something, maybe half an afternoon, to developing and thinking about the problem of the provision of assistive technology and disability more general in Nepal. So we developed that community of practice, and that involved different stakeholder groups, people with disabilities of various kinds, other stakeholders within the provision system, to try to map out some of the things we could do. Now, we were interested in localised production because we see that as one of the things that could facilitate things that a global system can't, and particularly complex needs is something that can't be addressed very well by global imports, by a global system of mass manufacture and a large-scale activity, which is vital, but it leaves these gaps, and complex needs is one of those gaps. So with these bespoke product developments, we looked at trying to address some of these complex needs and develop innovation capacity at the same time. In order to develop those products, we put together a team, a co-design team that touched upon more of the system of provision than we see as often is the case for innovation teams. So engineers, yes, they're nearly always there, but also clinicians, yes, more and more so. Clinicians are there from the start, co-designing with the eventual users as well. But as I mentioned in a different question, we also were including occupational therapists in that team, because we see the OTs as this possible bridge with users that maybe, for example, engineers might not be able to. They might not be able to communicate so readily, particularly for people that have less experience in this space of innovating products. So OTs can be this communicative bridge between users and the rest of the team, because that's often their job. Their job is to speak and understand and build that holistic understanding of what products, what interventions could be useful for a user. And we found exactly that, having that slightly expanded team base meant that we could start to answer questions a little bit better than what we would have done originally.
What advice would you recommend to early career researchers to create inclusive settings when co-creating or conducting research?
Yeah, so it's hard thinking of generalised points here to make. I think most important is to go slow and realise that you won't know exactly what problems that you'll face as you come into these environments and set off on these projects. That's one thing. So, and having in your plan this idea that things are not going to go to plan, and that you're going to need to probably readdress things as you develop what it is you're trying to do. Having that space to adjust to the different needs as you find them during the project time, I think is really important. Otherwise, you'll quickly have that sort of feeling of being behind and not being able to really. You're already doing it wrong. Whereas if you've planned for those things to go wrong, then they're not things going wrong. They're the learning experience. So I think that's a major bit. Because I think really an important point to realise is that the whole point of bringing in diverse perspectives in the co-design process, or in any process really, is that you don't have that perspective, and therefore you don't know what that perspective is going to bring, and you need the space, a planned space, in order to bring in that perspective effectively.
Can you share any common mistakes that researchers should avoid? Many things come to mind. There's often we must remember that, although in trying to bring in diverse perspectives in whatever project you're doing, the people that you're talking about, we might box those people into a single category that's fulfilling a certain stakeholder type, but of course they're not that. Nobody is. Everybody has a range of characteristics, personality, needs, all of these things, and that will be brought to the table. And so, similarly as before, it's just realising that you won't know what those things are until they arise. And so trying to just be open and just ready for change, I think, is important. Yeah. Is there anything else researchers should be mindful of when working with diverse audiences? So,
with all the best intentions and all the best research on a topic, you've got to remember that there's a huge range of very valid opinions that different people have in different contexts, and the important thing to realise is they often are all entirely valid, but they can be conflicting with each other. And trying to be ready to handle those conflicting yet valid opinions is hard. But as a facilitator of an environment, I I guess maybe one route through is to try to remember that you don't necessarily have to agree or very sort of directly validate a certain opinion in order to allow it and allow its acceptance in a group. Because, for example, you might find that other people in that group have a different point of view. I think that's one thing that comes through.